you ever wondered what it would be like to practice dentistry in another country? Maybe just for the sake of interest, or perhaps because you're considering a sea change? Then this podcast series is for you. Listen in while we ask key clinicians from our main dental protection jurisdictions about their practice experiences and ponder the unique challenges and opportunities experienced by dental practitioners in their part of the world. Hello, my name's Dr. Annalene Weston, dental legal consultant with Dental Protection, and I'm based in Australia in the Brisbane office. And welcome to What's It Like to Practice as a Dentist in Singapore. And today I am thrilled to be joined by Dr. Goh Siew Hor. So, hello, so pleased you're with me today, Siew Hor. Brilliant. So I'm going to start off by reading your bio and then we're going to go into some questions, okay? It's always, for those of you listening, quite stressful for the guest because they have to sit through the intro, then sit through their bio. So let's move through this and then we'll start having a chat. So Dr. Goh Siu Ho graduated from the National University of Singapore in 2008. He's currently an elected member of the Singapore Dental Council, president of the Singapore Dental Health Foundation, and member of the St. Luke's Hospital Medical Advisory Board. He was also president of the Singapore Dental Association from 2020 to 2022. Some difficult years to be president then, see. He's received several distinguished awards, notably the Singapore Patient Advocacy Award in 2018, a public service medal because of his work through COVID-19 in 2023, and partner of Labour Union in 2025. He was previously the chief business officer of a major dental chain in Singapore before he's just taken a bit of a career break, which I just love, to serve at a missions hospital in Papua New Guinea at the end of 2025. So we've been chatting really briefly over messages because Siu Ho hasn't had very good signal because of where he's been. So I think that's great. Thank you so much. Just to put some color behind that, would you mind telling us to start off with a little bit about your background and why you chose dentistry as your profession, please?
Yeah, so actually, a bit of my background, I've been in practice for about 17 years. In the early part of my career, I was with the government service. When you graduate from a local university in Singapore, you have to serve in the government service for 4 years. However, I did that for
4,
seven
and that's
years.
compulsory. Okay.
That's right. However, I stayed on and did for 7 years. In between, I managed to study part-time to get my Masters of Business Administration, MBA. So I've been involved as well later on with the Ministry of Health. And then later on, I went on to a public hospital and I was overseeing clinical operations for the medical, dental, and the surgical divisions. The service quality and as well as the outpatient operations. Subsequent to that, I joined a social enterprise and oversaw nursing homes, day rehab centers, the allied health profession, and of course the medical and dental clinics. Just before I left for Papua New Guinea, we did a strategic divestment of the dental arm. We merged with a bigger dental group, and together we became the second largest dental group, of which I was the chief business officer. Part of the responsibilities for that include overseeing the synergistic opportunities, or rather unlocking the synergistic opportunities between both groups. I look at new businesses. I look at how we can integrate operations to deliver more seamless experiences to our patients. Yeah. After which, I then, when the business was more stable, I decided that I also wanted to explore a bit about, a bit of how it feels like to work in a different setting, and as well as, of course, to sort of like just wind down, reflect on life, do a bit more journaling, do a bit more reading. And so I decided to head off to Papua New Guinea. It was my first time there and I really enjoyed it. So I would say that anybody who has a bit of a spirit of adventure should try that as well.
Oh, that's
Um,
fantastic. Thank you. Because you were volunteering, of course. So if you'd not been before, why Papua New Guinea? Why was that the place? Were they just looking for volunteers or was there something that drew you to that environment?
Yes, so I actually considered a few places. Someone suggested Africa, and I thought maybe I would not survive Africa. So I said, let's not challenge myself too much. I found out that Papua New Guinea used to be a colony of Australia, or rather British colony. So even their pidgin language, which is called Tok Pisin, has got English roots. So I
Sure
thought that,
does.
I mean, if you wanted to do something that is a short stint, like 3 months. I was there for about 3 months. I didn't want to struggle so much with the language. At the
That's
time,
fair
also,
enough.
there was a real need, and I knew about a Christian Missions Hospital from France. So I thought, why not just apply there? I mean, I could then use my dental skills, and I did know that there was a need because they didn't have any foreign dentists at the point of time working in that hospital. So I thought that there was an opportunity to contribute. I knew that it was a great place, the air is good, the people are nice, and so I said, well, it checks all the boxes, so why not?
That's great. So when you were in Papua New Guinea, what type of treatments were you doing?
Yeah, so Papua New Guinea, I think one of the bigger challenges is that they still chew a lot of betel nuts. So betel nut chewing is still a very common practice there. So we have quite a number of highest incidence of one of the highest incidence of oral cancers. The other thing is also because I was practicing in the highlands, there was a lot of tribal fighting, and so they inevitably end up with jaw fractures. Now in
Gosh,
Singapore,
okay.
for jaw fractures, you do an reduction and you plate it under GA, but because of the limited resources, I had to do I had to revisit my arch bar wiring, and yeah, so we did at least one a week. Yeah, so
Gosh,
that
my
was an interesting
goodness.
experience.
I bet it was. Did you find then with the patients with oral cancer, was that often an incidental finding? So they'd come in with, say, a toothache, and then you'd have a look and there would be more than the patient realized there. Was that, or was that what your experience was, or?
Yeah, so I think there was both. One was an incidental whereby they came in for a separate issue and then we find something, we biopsied it, and it turned out to be cancer. The other one, of course, is that some of them had allowed the growth to happen until it was so large that it could not be ignored. Yeah, so we do have two groups, and I guess also it's because of the lack of awareness, or even
Yeah.
sometimes, unfortunately, the lack of resources in
Yeah,
order
it's
to
sad, isn't
to
it?
afford dental treatment. Yeah.
Yeah, super sad. Now, that must have been, I'm assuming, because I want you to tell me about practice in Singapore. I'm guessing that then, with your arch bars and your fractured jaws due to fighting and your oral cancers rocking in, is very different to what working in Singapore is like. Is that correct?
Well, fortunately, yes.
Yeah. Okay. So what would be some characteristics or distinguishing characteristics of Singaporean practice? So particularly, I think, because you've got that beautiful comparison to Papua New Guinea, which has like from what you're explaining, a bit of a resourcing issue. So then comparing that to Singapore, what is some distinguishing characteristics be, do you think?
Yeah. So I think in Singapore, we are considered a very modern society,
Mm.
and the interesting characteristics is that actually um, we are a multiracial society as well. So we
Yes.
have many races, and in fact, about I think one third of the population, current population in Singapore, is actually migrants, meaning that they've come into work.
Well, it's
So
a beautiful
in a daily
place. You can't
practice,
blame them.
yes. It is, and we do actually invite, and we are very welcoming to even people from all over the world. In fact, sometimes when you walk in the streets, you can't tell who is local and who is from overseas, right? So I think it has, I mean, our government has done well to incubate this culture where they call it a melting pot, where different people
Yes.
come together and we celebrate their diversity. So that diversity can also be seen in daily practice. You don't get exclusively people from just one race or one group. You do get quite a number of people every single day from all walks of life coming into your practice, and so that really gives you that texture to the practice itself. The other thing is also that I think even as we develop, people are becoming more aware of the options available to them. So we do have people coming in for a bit more complex work, for
Yeah.
dental rehabilitation, things like root canals, crowns, what do you say? And I would say that one of the other interesting things which I find relating to also the fact that we do have so many people from all over the world coming in is that you get to see dentistry from all over the world.
Yeah, I bet you do.
Yeah. So in fact, things like the Japanese, some of these dentists, they do beautiful gold inlays, and you're like
They
just
do.
sometimes I just take a while to like admire the artwork, and I was like, wow.
Yeah. I've seen some beautiful Japanese work too. I have a big cohort of Japanese patients where I live in Australia, and some of the work that they walk in with is absolutely stunning. And you wonder who made
Yeah.
it, like, because as you say, it's so
Yes.
beautifully carved. You wonder did who actually made that? Did the dentist carve that like in the evening,
Yeah.
or are there some really skilled technicians?
Yeah, so I mean, I sometimes just enjoy right down to some of it where they have this. I think they call it the jacket crowns, where they trim a bit and then you have an opening so that the enamel shows through. So we do get all sorts of types of work from all over the world, and sometimes rather than say why is it done this way, I'm thinking to myself, well, everyone has got their own art and everyone practices in their own way based on whatever resources and training that they have. And yeah, you just take some time to appreciate it before you go on. So I think it's wonderful to be able to connect in a way with different people around the world through their work as well. So I
Oh,
think
that's
Singapore has
great.
been yeah, I mean it's a wonderful place to be.
No, it is. It's a beautiful place. So I'm curious then, some of the colleagues that we've spoken to have described what their working days are like, and they're quite different depending where you are in the world. So, what would a working day for a dentist in Singapore be like? What type of hours do you work? How long would your appointments to your patients be? And I'm curious to know as well, if you're working in a city or a more regional area, are there some changes in that?
So in Singapore we are very small. So I think every practice is a city practice. Um, that's why we call it a we call ourselves the Lion City. Practice usually, dentists in Singapore, I think we work very hard. Most dentists would start at about 9 or 9:30. Maybe if you're a bit more senior, you come in later at about 10. And usually you get a lunch break before you continue in the afternoon until about 5 or 6. Some may then take a break for dinner before they continue on to 7 to 8 o'clock or 9 o'clock in the evening. Yeah, so that's kind of like the typical. Usually, most of the times for junior dentists, as a junior dentist, I usually do a bit more evening sessions to sort of build up my patient base because the day was a bit more free. So most people would then come up to work. But of course, as you become a bit more senior, then people know you. They would actually make time to come to see you. And then you see less emergency cases, you see more routine cases. Then you start to reduce your hours to just to the office hours. Most
Yeah.
dentists in Singapore would also work one weekend, one day, either a Saturday or Sunday, for about half a day or even the full day itself. Yeah, so I think in Singapore we do work very hard.
Yeah, I think you do as well. And it's been really interesting. I think it will become as a surprise to some of our colleagues who are listening that it's quite standard in countries like Singapore, Hong Kong to work and see your patients in the evening. Now, of course, I knew this because when we try and schedule CPD for you, it's really difficult for us to do it in the evenings because you will work so late. So it's not uncommon for us to actually put CPD for Singapore in on the weekend, on a Sunday, for example, because it's the only day that
Yes.
you have free. Otherwise, you're really restricted because of the hours that you work. So, you mentioned patients coming after work in the evenings. How do you think patients in Singapore commonly approach their oral and dental care? Is it considered to be a priority, or for many people, is it considered to be perhaps a luxury item? So, are people really good at coming and everyone comes for their checkup and clean, or what's the approach? What's the attitude, do you think?
I think it has improved over the years because of the government's efforts to promote healthy living, not just in dental care, but in health in general as well. So we call it Healthier SG, SG meaning Singapore. So things like eating well, doing your necessary exercise, taking steps and all. I think in general, awareness in Singapore is quite good, but whether that awareness, that knowledge translates to action. I think that's where we are trying to bridge the gap. So during the time when I was the president of the Dental Association, as well as the Dental Health Foundation, we actually did a study in 2021, looking at about 500 over respondents, and, and looking at their attitudes to dental health and dental treatment and their health belief models. So interestingly, um, 4 in 10 do not visit the dentist regularly. That was in 2021. I think it may have improved since then. But the interesting thing was that even though they did not, 50% of those interviewed actually felt self-conscious and embarrassed about their own dental health. Now, this is interesting because sometimes in different cultures, when you feel that there's a problem and you're embarrassed, for some, they may just immediately say, okay, I need to get this fixed. But sometimes for Asians, we are also a bit more, so embarrassed that we don't even turn up at the dentist because we
Yeah.
may fear that you get criticized, or that you feel embarrassed to open your mouth to a profession and have him say, oh, and you fear that they will say, oh, what happened? How did you allow this to come to such a state, right? So because of that, then they stay away until it is a bit too late. So, in fact, when we interviewed and we asked questions like to assess their level of health understanding, things like there's nothing wrong with your teeth and gums if there is no pain. Is it true or false? More than 80% were able to tell us that it is false. So I think there's, in terms of dental knowledge, our our school systems have done well to really educate the public in it. But I guess what we are now trying to do is how do we help people to take that step, right? Maybe having more friendly practices, telling them that there's nothing wrong with having bad teeth, but the most important thing is you need to take that step to go and fix it, right? Maybe you've been busy at work, maybe you've been busy with bringing up your children, and so you have neglected aspects of your life. Now it's time to reclaim that. And that's perfectly fine. So I guess this is the kind of messaging that we want to put out to the public, that it is perfectly okay wherever you are. We are just happy that you take that first step to come in to get your problems fixed.
That's lovely messaging, though. And I think that's a really interesting observation that there's a cultural barrier there, from what my understanding from what you're saying is, where people are not wanting to bring something that they're embarrassed with to a professional for fear of judgment or blame or shame. So breaking down and doing some messaging around that, saying it's okay, but also doing some messaging for your practitioners saying, you need to approach it this way or your patients aren't going to come. Did you find, because I made the comment that you were president of the Dental Association at just about the worst time? I mean, my goodness, how far into your presidency were you when the pandemic struck?
So what happened was that we are supposed to submit our intentions to run in about February and all, and then the AGM was May. So by then it was just the start of the pandemic, and
Hmm.
by the time I took office, the pandemic was in full swing. I think you remember that there was quite a lot of uncertainty and a lot of things, a lot of plans, programs had to be shelved. A lot of conferences, had to be cancelled or
Absolutely.
postponed. Um, and I think the first thing that we had to do was to look at the livelihoods of the dentists, because a lot of them were thinking, what is it? What does it mean for me? How do I continue with my livelihood? How long will this last? And what can we expect? Right? Is it safe to practice? So I think we spent a lot of time looking at the research. To update ourselves, talk to the officials in the ministry to understand the situation better, issue guidelines, and then also, of course, assure our professionals that we are definitely looking into how do we safely practice. Then at the later stages, as the practices started to open up, as the government relaxed its rules, it was just reassuring patients that it was actually safe to come back. Right, a
Yes.
lot of them had suspended their treatments, and there was a lot of misinformation going around. So
Yes.
we even went. I did a few media interviews. We put statements in the newspapers, and we issued assurances to the public that based on WHO findings and all, it was safe. I mean, the good thing was also that in Singapore we had a very high vaccination rate, so that really
Yeah.
helped.
So your COVID-19 experience would have been more favorable then as a consequence, I guess, is the inference of that. Yeah. So COVID aside, because let's be honest, that was quite a challenging time. What type
It
of
was.
issues? Yeah. What are some of the biggest challenges that dentists in Singapore are facing right now? So, I guess to contextualize that question, in Australia at the moment, many of our patients have a co-pay system where they pay money into their health insurer. And because we're in a cost of living crisis, a lot of Australian patients have dropped or removed their cover altogether, which means that they now carry the full cost of dental treatments, which means that dentist books in some places are gappy, particularly if they've relied on those health fund contributions to assist patients. So, is there anything like that going on in Singapore? Are there any similar challenges people are experiencing?
So I think that in Singapore, the good thing is that the government has been quite consistent in terms of its application of whatever portable subsidies. In Singapore, we have this thing called the Community Health Assist Scheme, which is actually a portable subsidy, which, in order to try uh, to spread the demand. Otherwise, the public dental clinics would be very full. They do identify a group of people who would be able to then utilize healthcare, private healthcare services. What the government does is that it pays for a certain portion of the uh, of the treatment if you qualify for these subsidies, and then of course the rest, the remaining out of pocket, is borne by the patients. These subsidies are means tested, meaning that they look at your income to see what you can afford, and before they put out these subsidies. Um, so what happens is that currently what has happened is that the government has recently last year, the late of last year, issued a what we call a fee benchmark. So a fee benchmark is where they take all the clinics and what their relative their prices are, and then they take the 25th to the 75th percentile, and they have then published it, all right, so that patients would then be able to make decisions about where to go, right? It gives a bit more price transparency for the public. Now, the thing is that um, what of course it does is that it sort of like then people start to congregate or aggregate their prices around these benchmarks. However, of course, we all know, I think it's throughout the world whereby you have got property price inflations that are very much higher. People have tried to catch up, or rather the real estate REITs companies that run a lot of these commercial properties have tried to catch up. And so in terms of inflation rates, even though core inflation in Singapore is manageable, but in terms of commercial assets inflation, price on rental inflations, it hovers around 4% every year, or above 4% every year. So I think what we do see is there's going to be a bit more of a squeeze on the price pressure. And so what would naturally translate is that I think people are just going to work longer in order to sweat out the assets. So I think dentists in Singapore will continue to work as hard as those in Hong Kong. I think that's the same experience that probably people in Hong Kong face as well.
Just to be sure I've understood what you've been explaining, the patients can be eligible for the public health system, but the price pressure is actually coming down on the dentists. But you can't necessarily pass that price inflation onto the patients. You're getting squeezed.
Yes.
What a blessing. So the public system's service is quite busy. A lot of people are eligible for those treatments.
Yeah, so what happens is that in order to relieve the pressure, for example, I think about 50% of the population is covered with a very basic subsidy. So that, for example, when you go to a dentist, maybe about 70% of the scaling costs, right, is covered by the government. 70 to 90%, depending on what the price is. It's a certain fixed sum. And then they're eligible to do two scalings a year. Yeah. So they go to a participating clinic where the dentist then sees these patients, who would otherwise have to go to a public dental clinic for subsidies.
Okay, okay, that's really interesting. So, what type of treatment? So, you mentioned that there's a broad range of treatments, including crowns and root canals, and patients are becoming more aware of the different types of treatments available. Are you still dealing with a lot of emergency or urgent care, or are you finding that people are looking for more discretionary treatments like cosmetic treatment, or is it a mix, just a big old mixing pot, just to max the mixing pot of different patients that you have?
Yeah, so I think, I mean, at least for my own practice, I mean, it could be just the demographics that I see, or it's just that because I've been in the area for a while. Um, I mean, in my last practice, I was there for about 10 years. So, I mean, initially we saw a bit more emergencies, but later on we started to see more discretionary sorts of treatment cases. And in fact, the types of emergencies that we see may not necessarily be due to neglect. It could be things like cracked teeth.
Yeah.
Singapore, in very highly stressed societies, we see a higher incidence of cracked teeth. Or yeah, or it could just be like a filling that dropped out, an old filling that dropped out, and the teeth is now sensitive. So I guess the reasons behind these emergency visits, I guess we see less of dental neglect, and we see more of the fact that actually because more people are starting to get dental work done, and everything that we put in the mouth has got longevity. So at some point you can't tell when it's going to drop out, right? So when it comes
No, you
out,
can't.
we,
If only we could.
yeah, it becomes an emergency. I mean, I wish we could. My nurse would
Life
really
would be
love
so
it
much
because that
easier.
would help with the scheduling.
Yeah, that's right. We could tell them we've got another 18 months for this, but we just don't know, do we? It's interesting what you're saying about high incidence of cracked teeth and stress. I'm guessing that's partly due to just those really, really long hours that culturally are the norm in Singapore, aren't they? It's not just dentists working those long hours, it's a cultural norm. So I'm curious to know one of the factors that's been quite different depending on who I've been speaking to is the continuing professional development requirements or expectations within Singapore. So, what are those currently for dental practitioners?
Every 2 years, we need to accumulate 70 practice points. We call it practice points.
70.
Actually, we call it continual dental education points, but I guess for simplicity's sake, we just call it practice points, of which 50 need to be verifiable. Verifiable means that you need to attend a course, there needs to be an organizer to make sure that your attendance is taken. They will issue you the points, right? They put it in the system and it gets registered as points. 20 points can be non-verifiable, meaning that if you read a journal, you submit the article that
Listen
you
to a
read, and
podcast.
yes. Yeah. Currently, it's I think just the journals, and you're able to then get those points. Of course, there are two compulsory modules. One is the basic life support. So every dentist, unless you have been medically exempted, will need to be qualified in basic life support. The other one is we just rolled out a new, I think last year, an ethics module.
Brilliant.
So it's an online self-assessment system whereby you go through the lectures and then you answer questions. And the reason is to make sure that practitioners are familiar with the ethical standards and guidelines that Singapore practices. Yeah.
That's wonderful. And did the Singapore Dental Council create that module that people need to work through?
Yes, so it has actually worked with some of the bigger like Academy of Medicine, and currently we are looking to have more providers to do that as well. I think the important thing is the intention is really to ensure that everyone who practices are updated, because sometimes these guidelines do get updated, or there are new additions to it, especially when we start to look at teledentistry or even right now AI. So I think that as we develop it, as things change, we want to make sure that you may have graduated like 20 years ago, and the standards then may have there may have been some changes. So we just want to make sure that everyone is up to date with it.
No, that's so good. And just because I'm curious, you talk about practice points. Is a point an hour or is it 1 hour could be more than 1 point?
Yeah, so it's generally in Singapore it's 1 point for an hour.
So where in your 6 day a week working 9 till 9 are people finding the time for that? That's a lot.
Yes. So I guess I mean for for professional education, it's really an investment, and you really have to take time off. So people do block
Absolutely.
their clinic sessions. Yeah. Um, I mean, I think it is something which is non-negotiable because
No,
if you really
absolutely.
want to do what's best, you have to do it. Yeah.
Yeah, no, absolutely, absolutely. I mean, it's a requirement of your registration, I'm assuming, but it's like it's a for the long hours that you work, that feels like a big number. Bearing in mind, in Australia, it's 60 hours across 3 years, which I think is too small. So I think somewhere in the middle is probably feels fairer, but who knows? That's really, really interesting. Okay, so do you think that we've talked about the benchmarking, we've talked about the fact that the majority of dentists are in, well, not the majority, sorry, but there's a big cohort of dentists in private practice treating patients in private practice, and that there's also schemes where people can be seen in private practice who wouldn't necessarily have been able to, they would have been waiting for public. Is there still a bit of an issue with access for care to patients, or are the barriers more the barrier that we talked about culturally and also the traditional barriers of can't get time to off work, can't afford it, like those more traditional barriers? Is there an access issue, do you think? Or do you think most people could get there if they wanted?
Um, I would think that in my personal view, most of it is cultural barriers. Though that said, I think there's these one of the more unique challenges is really on the elderly population because now they have mobility, they are limited mobility, and now of course most of the caregivers are actually working. All right, so then who is going to take that to the dentist? And sometimes also because of the cost of real estate, a lot of clinics sometimes may not have proper wheelchair access because they are very small, they're very narrow, and you really need that space in order to be able to put in a wheelchair properly. So I think there's something which we are, I think the government should, or rather is looking at as well. How
Yeah.
do we allow there are these, I would say more of these segments of these populations that may have barriers to getting treatment for very unique reasons. I think the other one being also institutionalized elderly, those residing in nursing homes or or care facilities, because the needs there are quite overwhelming. So when do they actually get? Because to get them out to a dental clinic, you actually need to assign a nursing aide to accompany them, and you need a special wheelchair-enabled van to transport them as well. So I think there are these unique challenges rather than cost issues, right? I think cost issues generally government has done quite well in dishing out the appropriate levels of subsidies so that people will be able to access care when needed.
That's fantastic, but those other barriers persist. Now, you mentioned telehealth. Is teledentistry common, even to assess these patients who are institutionalized?
Currently, I think not really because I mean it's quite accessible and wherever you stay, you could easily find a few clinics within the 1 kilometer vicinity. But of course, I think what we are looking at is are you able to provide education, especially for those who are less mobile or to treat? I mean, there hasn't been a real clear business model that's emerged yet within Singapore itself. I hear that there are people that are exploring, but I guess it's a space that we just have to wait and see.
Yeah, okay. Interesting. And mobile dentistry is quite big in Australia. And also, I uncovered last week, quite big in New Zealand too, in parts. And so it's a way that we get round some remote communities, which I appreciate isn't as
That's right.
much of an issue in Singapore, but also nursing homes, for example. Is that something which is taking off in Singapore or not something that's really been considered?
I think it's the form in which some people have tried to explore is really are we able to, for example, use images from phones and all this to sort of identify early problems. So, for example, in nursing homes where a trip to the dentist could be very costly in terms of time and expense, how do we then identify, treatment that, I mean, conditions that need us to address urgently versus those that we think like, okay, we can do it at the routine dental visit itself, right? So I think there have been some efforts to try to see if we can use intraoral videos or intraoral images uh, to be able to then triage the dental needs itself. So, but that has been ongoing. I think there hasn't been any further conclusion yet, but I think that could be one of the potential uh, game changers, or rather improvements, right, towards even as we age and a lot of people stay home. Perhaps that could be one of the things that in the future, before you go to the dentist, before you take leave and all this, maybe you could scan the mouth and then send
Yeah,
the
that'd be
images, and
cool.
they'll tell you what's the likelihood that you need to see, how urgently you need to see the
Yeah.
dentist.
It's a cool idea, isn't it? So this is just my curiosity, I have to say. You mentioned about the changing standards, and absolutely it's critically important to stay on top of changing standards, because what can happen, you gave the example of someone who'd graduated 20 years previously, is you can still be practicing dentistry that was safe in 2000, but the standards have shifted, and what's happened is you've stayed the same and the standard's gone up. So you've fallen below. I'm really curious about AI. I feel like every time I go on the Australian dental social media pages, there's another AI tool. And I'm really curious, is that the same in Singapore? Is early adopters for AI, or are people a little bit cynical and they've got too much to worry about with the costs of their commercial properties to be worrying about too many new tools?
I think in terms of the application of AI, I would say that AI applications in terms of business processes, in terms of having chatbots and all this, or even doing up your website and all, I think the adoption is a bit higher. Now, as to whether you want to use AI for clinical practice, that is still being explored. People do, because you know. At the end of the day, you're responsible for what the outcomes, right? And you can't
Yes,
say that,
you
oh, the
are.
AI gave
That
uh
AI was having a bad day.
suggested this to me, right? ChatGPT told me to do this, right?
Can you
And
imagine? I bet we're gonna get
that
that, you know. I bet we're gonna see that sometimes. I do, but we'll see.
But I think the more interesting thing is really patients using AI. So they would come to your practice, and whatever you tell them, they have their consultant coming with them. It's not their mom or their dad. It's ChatGPT, it's Gemini, it's one of those AI providers, and they're just keying in as you talk, and they're just verifying it just to make sure that whatever you say, right, is up to date. So in fact, I think that should motivate more of dental practitioners to keep up with their knowledge, because right now it's so easy for patients to verify whatever you have said.
No, it's a really, really good point. And the other thing that we're seeing is patients complaining and getting Chat GPT to write their complaint letter for them. We see that all the time working for dental protection. And you can tell because Chat GPT actually very much has its own style. But what I find worrying is then when practitioners get ChatGPT to write the letter back, because again, it has its own style and it's not necessarily how you want to be presenting yourself as a professional. So I want to just pop back to, I'm really curious about what you love about being a dentist in Singapore, but I'm also curious to know your volunteering time in Papua New Guinea. Did it fill the same cup, or did it fill you for different reasons? You know, was it just being a dentist? You love being a dentist. What do you love about being a dentist in Singapore? And what did you love about that volunteer time in Papua New Guinea?
Yeah. So actually, one of the things that I really missed when I went to Papua New Guinea was my patients and as well as my
Oh,
team.
bless you.
My team in Singapore was very sweet. They actually the video called me every week, and they said, "We're just trying to make sure that you are alive, you haven't been eaten." Yeah, I mean that was a joke, but yeah, uh, they
So cute.
they
That's
yeah. Yeah,
lovely.
so they said, are you surviving? Do you manage to find food? Yeah, because in Papua New Guinea, you kind of have to cook all your meals on your own. Um, and actually, I've got patients who have kept in touch with me. They've written in to me. They've asked me how I was, how I'm doing. and some of them said they would be praying for me. So I think that was something which really um, reflects the kind of relationship that has been built over the years. So the thing about Singapore is that actually we have a lot of nice people. We have got wonderful people, and family practice is something which I really really enjoy because you see the whole families, you talk to them, you see their kids grow up, and they share with you some of the important milestones in their lives. And yeah, I mean, dentistry is not just about fixing the teeth, right? It's about building that beautiful connection with people, right? And having the privilege of glimpsing into their lives. So, I really enjoy practice in Singapore because of the types of relationships that you can form, that can build, and even as you see them every 6 months, there's just I mean, I would spend a bit of time every at every session just to find out how they're doing before we get down to the dental work
Yeah, of
itself.
course. That's lovely. Relationship building. And 10 years is a long time to be with your patients
Yeah,
as a relatively young practitioner. It's not like you set up stumps and you practice there for 50 years and you're looking to retire now.
yeah,
That's beautiful that you had that community. I bet you missed the
yeah.
food as well. When you
But Papua New Guinea itself was interesting because they used to say that if you really love what you do, you would be willing to do it even for free, right? So I
Yeah,
decided,
they
okay,
do
let's
say
test
that.
this,
I
right?
have
Will I
heard
be able
that.
to do? So I decided that let's just try and see, right? How it feels like, whether there would and I had the same question that you had, right? Would doing this in a different context, a volunteer context, be any different, right? From, for example, in Singapore, when maybe I know that to some extent it is a bit transactional because I'm being paid to do this, though I don't always feel that necessarily that just because you're paid means it's transactional in nature.
Yeah.
Um, S- So, I mean, I was there, and I find that the human connection, even though we're a different culture and all, perhaps practicing in Singapore and being able to practice in this multiracial environment has really helped me because I mean, when I started, I just felt completely at home. The only thing that I felt a bit stuck at the beginning was how to do the arch bar because I haven't had to do one for a very long time.
Oh, it
But
must have been
otherwise, I
such
feel
a
that.
shock. Honestly, you must have been stood there like, huh, I've got this.
Oh, maybe I should ask ChatGPT on this, but yeah,
Yeah, maybe. What does chat say about this? Surely chat knows.
yeah,
Yeah, it's fascinating,
yeah,
isn't it?
yeah. But I guess that even the principles of practice about the human connection, about how people respond, they are the same, right? When you respond with sincerity, they can feel it, and they appreciate what you do, even though you may not be able to use many words because my talk lesson is a bit limited. I mean, I learned the important phrases like "open is still open." Close is passive, so I learned these things, the open and the close, right? And then to chill is they call it kai kai. So yeah, I've learned these basic phrases, but otherwise, even if they're just these basic phrases, I guess sometimes some of the things like the body language, like the sincerity and the authenticity that you bring into that session, people do feel it. I mean, we are all people that desire to have a genuine connection, and so you know, the things that make it that I find makes a practice fulfilling in Singapore, the same things can be found in Papua New Guinea. Of course, the other thing is really the time. They finish work at 4, so that's great. I got a lot more
Fantastic.
exercise
You wouldn't
in.
have known what to do with yourself. What did you do in your evenings then?
Yeah, so I spent more time reading because there were no movie theaters to go to, there were no
Good.
cafes to hang out at, there were no bars to go drinking with friends at. So I really gotten a lot more sleep and a lot more reading. Yeah, so that was quite a refreshing change, which I
Yes,
hope
of
that
course.
I can inculcate some of these habits into my daily routine now that I'm back in Singapore.
No, definitely, because that will be so good for your emotional health and well-being, I think. And I think, yeah, sometimes you need to disconnect to realize the importance of those things. Our lives are so busy and full, particularly when we are high achievers. And it's good sometimes just to disconnect. That's wonderful. So, I'm a great believer in volunteering. I think that your advice at the start, if you're interested, just go, is fantastic advice. What about for somebody who would be interested in practicing in Singapore, so an overseas trained dentist? Is that something that's relatively easy to do, or is the pathway quite complex?
Yeah, so it really depends on the on where you graduated from because we do have a list of recognized universities. The list can be found on the Singapore Dental Council website. So it has quite a detailed descriptions. Um, but assuming that you are able to practice, you're qualified to practice, you have to find a practice in Singapore, and then you get a supervisor because you're still under conditional registration for at
Uh-huh,
least two
okay.
years.
Must it be direct supervision? Someone on the same practice as you?
Yes, it has to be somebody direct supervision, but he doesn't have to. I mean, you have to be within the same practice
They
at
don't
the
have to
same
be
time,
here
but he does.
watching.
No, you don't have to be.
That's good.
Yeah.
Oh, that's good. And how long do you stay under that supervised practice for?
So you stay for at least 2 years. It also depends on the supervisory assessment reports. I mean, if you if assuming that your supervisory assessment reports are satisfactory, then you can apply to the council for full registration after that 2 years is up.
So, what advice would you give to anyone wanting to practice in Singapore? Do you think they should just hop on in and have a go? Or do you think come out and have a look first to see if it's what you're expecting?
Yeah, I think you really need. I mean, I would definitely advise for you to come out and have a look first because I think in different jurisdictions, different countries, there are particular ways in which people interact and the way people do things as well. So in fact, even like for example, when in Papua New Guinea, I had to kind of learn what their common practices were. And then for some, I actually tried as well to stay within what is culturally acceptable for them as well. So I guess coming in, I mean, Singapore is very cosmopolitan, but I mean, in terms of practice hours and practice expectations and even in patient expectations, I think just
Yes.
coming in just to look at the practice and just deciding that, yes, this is something that I want to do is important. And then I think the other thing is also about lifestyle as well. So some people like a more quiet sort of existence, something that you can wind down. In Singapore, there's just bright lights everywhere, and
It's not for you.
if you kind of like the energy, then that's great. But if you need to wind down, then yeah. So and also really being you need to kind of love that diversity. Some people manage diversity better than others like I said earlier in the podcast, that because we have so many different international patients as well as local patients of different races, different cultures, different ethnicities, so you really need to really enjoy having that diverse or treating that diverse mix of people. So I guess also the most important thing is that you really need to love to you know be curious, right? You need to have that curiosity in you to want to know more about this.
Oh, that's fantastic. Would you think that speaking more than one language would be quite helpful in Singapore also?
Um, Yes, I give an instance like a lot of them, the older generation, the Chinese, they speak Mandarin. Some of them speak dialect. I don't speak any dialect, or rather, my dialect group is a bit more rare, so it's hardly spoken a lot by a lot of patients in Singapore. So I try to use Mandarin or sometimes try my best. And when they see me struggle, they have a good laugh at it, and then they appreciate the effort, right? And then after
Points
that,
for
the
effort,
session
2
goes well.
points for
Yes.
pronunciation.
Yeah, so I think most of the patients know that you are trying. I think the most
That's
important
good.
thing is that you want to demonstrate that you are trying to bridge the gap. And I guess most of them they have realistic expectations. They don't expect somebody from overseas to sort of like know the full language and all. But I guess if you try, patients here are very forgiving. Yeah, they would
I know that's
definitely
beautiful.
appreciate that.
That's beautiful. Thank you so much. And just one last question then. If you were to give one piece of advice to any recent graduates or people who are aspiring to be a dentist listening to this, what would you say to them? Just about dentistry, I
Yeah.
guess.
I think sometimes we focus so much on the technical skills, but technical skills at some point can be picked up with just disciplined practice. I think more importantly is we need to love the people that we treat. I mean, that's the reasons why we get up every day, right? Imagine if you really don't like what you do, it's going to be a drag. Going to professional education, upgrading your technique and your skills. Would seem like a waste of time and money, right? But if you really enjoy treating your patients, you enjoy that connection. Even when you go for your practice upgrades or courses, you're thinking, what can I do for this patient, or what can I do for that condition that I just saw? How can I, give them something better that would wow them, that they would say, hey, doctor, now you can do this, right, for me, right? And then just the thought of it really motivates you to go. So I think the most important thing is really to stay curious and really to stay humble and just really enjoy building and not focus on what on. I mean, uh, people would advise differently, but for me at least, the advice that I usually give is that don't focus on the money, don't focus on the reputation, focus on the people that is before you, and do the best for them, and you'll find that whatever they give you in return is much more than money can buy.
Oh, that's a beautiful message. Thank you so much. And of course, if you focus on your patients, the money actually finds you. So
Yeah.
thank you so much, Siu Ho. I've enjoyed speaking with you so much, and I'm so grateful for your time. And I really hope that we get the opportunity to catch up in the future because I'm really curious what your next adventure is going to look like. And so thank you, of course, to everyone for listening. If you'd like Dental Protection Podcasts and you'd like to hear more, please subscribe and leave a review.